the question here, the nurse is providing postpartum instruction to a client who will be the breastfeeding her newborn. The nurse determined that the client has understand the instruction if she makes which statement? Select all. Out of 6, which one is perfect or okay about the breastfeed? So when nurse educate the patient, after education, you must get the feedback. They understand or not. Which one indicate my patient understand my instruction, yes or no? So after the delivery, the breastfeeding and about the breast care is very important, right? So first they said I should wear a bra that provide the support. Definitely it makes sense. We educate the patient to wear the tight fitting bra or also keep some ice. If any discomfort feel, they can use it. So definitely it is the good choice, right? And drinking alcohol can affect my milk supply. So some kind of food can cause the decrease the milk production, and some kind of practice or food increase the milk product. Like they say, drinking alcohol can affect my milk product. Yes, it is. So she is right, because caffeine or alcohol reduce the, or some medication can reduce the milk production. Use of caffeine can decrease my milk product. Definitely it is, right? And I will start my estrogen birth control pill again as soon I get home. So I said it is not a good choice. Patient start the uh, oral contraceptive pill during the breastfeed, right? It is not a recommended by the uh, medical science. I will start. No, I know if my breast get engorged, I will limit my breastfeeding and support the baby. Definitely, it is not a good choice. Engorged means the breast is full of milk. Better to give the baby breast milk or feeding. And during the feeding, make sure baby is correctly uh, put the areola inside their mouth. So take in part of the areola, not just the tip of the nipple. Hmm? Also keep in mind, breastfeeding produces oxytocin, and oxytocin helps to contract the uterus and prevent the hemorrhage. So number 5 is not a good choice. And number 6, I plan on having a bottle of water available in the refrigerator so I can get a additional fluid easily. So enough fluid intake, at least every day, 3 liter or 3000 milliliter fluid is good for the milk production, it is a good choice as well, right? So what are their rationale or explanation? The postpartum client should wear the tight and fitting bra that is supportive. And also the common cause decrease the milk supply include formula, inadequate rest or diet, smoking, or alcohol or caffeine. So it is good, tell your patient not to intake alcohol, caffeine, don't smoke, take enough rest, take enough calories, uh, at least 2,800 calories per day is recommended. Breastfeeding clients should increase their daily fluid intakes, at least 3 liter fluid per day, right? Intake. Having a bottled water available indicate that postpartum client understand the importance of increase the fluid. If engorged occur, the client should not limit the breastfeeding. And also, it is good to should the breastfeed frequently. So expected findings, educate your patient at least 8 to 12 feeding per day or 6 to 8 wet diaper per day is good. It indicates baby is feeding well. Also 4 or more yellow bowel movement per day is expected findings, right? Here some note every student must know about the breastfeeding. So we have to encouraging mother to take at least 2,700 to 2,800 calories per day. And also encouraging mother to take 3 liter or 3,000 milliliter fluid per day, because enough liquid intake helps to milk production. Enough diet, calorie intake helps to enough milk production. Here we write some medical condition. In that medical condition, it is good mother do not give the breastfeed to the children, her newborn. So contraindication to the breastfeeding. If mother have a tuberculosis, or if mother is HIV positive, if mother diagnosed breast carcinoma or hepatitis, it is good not to give the breastfeed. If mother under chemotherapy or radiation therapy, better to stop the breastfeeding. Some medication like lithium. Lithium is a mood stabilizer. Usually we give them bipolar disorder. Lithium has chance of toxicity develop. So if mother take the lithium or chemotherapeutic agents like methotrexate, tell your patient not to give the breastfeed. Some condition which is common in the infant like lactose intolerance. If the baby have this problem, it is good not to give the breastfeed. What next? Question here, the nurse is teaching the postpartum client about the breastfeed. Which instruction should the nurse include? The 4 option here, which one is the correct, we could include during the teaching to the patient. Number 1, the diet should include additional fluid. It is very good choice. We encouraging patient to take at least 3000 liter fluid if they are breastfeed. So good or adequate calorie is important, enough fluid is important for breastfeeding mother. Definitely number 1 is a good choice. What about the number 2, 3, and 4? Why not number 2? The prenatal vitamins should be discontinued. So definitely they should talk to the healthcare provider. If healthcare provider said they will continue or they will discontinue, it depends. And this number 2 is not clear basically. Nothing is prescribed. Soap should used to clean the breast. No. During the education, we tell them use a clean water. No soap. It is alkali, right? And also, birth control measures are unnecessary while the breastfeed. So there are no relationship between breastfeeding and contraception. There are no relationship. So they should talk to the healthcare provider about the contraceptive method. Maybe the healthcare provider tell what the barrier method to use. And during this time, definitely we tell mother about the mastitis, inflammation of the breast tissue, mastitis. And if mothers see any inflammatory change in the breast, tell them to use the moist heat. And always we encouraging mother for breastfeeding. It is good for the mother, it is good for the baby. So 1 is a good choice here. And what is the rationale? The diet for breastfeeding clients should include enough fluid. Prenatal vitamins should be taken as prescribed, and soap should not be used on the breast because it tends to remove the natural wells, which increase the change and develop the crackles nipple. So now here, the breastfeeding is not a method of contraception, so birth control measure should be resumed. It is important. Question here, the nurse is preparing to assessment the uterine fundus of a client in the immediate postpartum period. So after the delivery, we have to assessment the fundus, right? After locating the fundus, the nurse note that the uterus feeling soft and boggy. Which nursing intervention is appropriate? So if you see in this question, the uterus feeling soft and boggy, right? So after the birth means postpartum, fundus should be firm, but here soft and boggy. But what we know, it should be firm and it should be midline and at the level of umbilicus, right? So during the assessment, we assess the fundal height, we assess the uterine placement and uterine consistency. This clinical scenario, the nurse noted the uterus is soft and boggy, but you know it should be firm and boggy. But so something wrong. So what is our nursing care? There are four options. If it is soft and boggy, we have to go elevate the client leg. It does not any role. Massage the fundus until it would be firm. So we already know that it after the postpartum care, the fundus will be firm. So we found similar keyword here. So massage the fundus until it would be firm. Good choice. Ask the client to turn on the left side. It no effect. Push the uterus to assist is expressing the clot. It also do not related to this question. So what is the rationale here? And as I told you, nursing education is important. If the fundus is displaced laterally, always have patient empty the bladder and encouraging boarding every 2 to 3 hours. If we see the fundus is boggy and we massage the fundus or we massage the fundus in circular motion. Also, it is good to admin oxytocin as prescribed to increase the uterine contraction and prevent the hemorrhage. So oxytocin is an important role after delivery. They contract uterus and prevent hemorrhage. Also, we should encouraging mother for breastfeeding and breastfeeding to stimulate the release of oxytocin. So if the uterus is not contracted firmly, the initial intervention is massage the fundus until it will be firm and also express the clot that may have accumulated in the uterus. Elevating the client legs and positioning the client on left side would not assist in managing the uterine atony. And I told you, admin oxytocin is prescribed to increase the uterine contraction and prevent the hemorrhage. And we encouraging mother for breastfeeding and breastfeeding to stimulate release of oxytocin. What next? The question here, the nurse is caring for 1 day postpartum client, first day after the delivery. Which client assessment require need for further follow-up? Something wrong with the patient? Need to call for the follow-up, right? Number one, the client with a mild after pain. So after the delivery, it is natural the patient have mild type of pain, nothing abnormal, no need to follow up. The client with a pulse rate 60 beat per minute. 60 beat per minute is normal. it should be 60 to 90, right? So it is nothing abnormal. Borderline. The client with colostrum discharge from both breast. Makes sense. It is true. Nothing abnormal, right? The first milk we call colostrum, which is the very important for the children. So colostrum is secreted during the pregnancy for first 2 to 3 days immediate after delivery. Definitely it will be discharged from both breasts. Colostrum is rich in antibodies. It is rich in protein and fat-soluble vitamin, very important for the newborn. Number 4, the client with lochia that is red and has a foul smelling odor. So it is red is good, and red should be red at the first day, bright red. It is bloody because first day after delivery. We called rubra. The lochia, the first 1, 2, and 3 days, it would be bright red, bloody, we call rubra. But rubra, no odor, or slightly fishy odor, but slight, not too much. But if it is foul smell, it indicates something wrong, infection. They have to come for the follow-up. So after 3 days, the secretion we called serosa, and it is the pink secretion, and also no bad odor. And after 7 days, the secretion little bit creamy and yellowish, we call alba, very important. So here, this is the indicator, need to come. What explain lochia, discharge present after birth, and it would be red for first 1 to 3 days and gradually decrease in amount. The normal lochia has a fleshy odor and an odor similar to menstrual flow. Foul smelling or purulent lochia usually indicate infection, and these findings are not normal, right? The other option, I mean, definitely other is normal. So I said something important I want to add. Usually in the first 1 to 3 days after delivery, 4 to 8 pad per day is normal. Okay, it is. So what next question? When performing a postpartum assessment on a client, the nurse note that the presence of clot in the lochia. The nurse examine the clot and note that they are larger than 1 centimeter, which find it the most appropriate. So during the discharge or when we assessment the lochia, and we said the first discharge is called rubra, it should be bright red, it should be bloody. But if the clot, little bit clot is okay. But if the clot is bigger than 1 centimeter, we need to take the assessment, further assessment. So now, which nursing action most appropriate? Document the findings. It is good choice. Document the findings. But what else? Reassess the client in 2 hours. What next? Notify the healthcare provider. What next? Encouraging increase the oral intake of fluid. There are 4 options, right? Number 4 is not an answer. Patient develop a bigger clot, there's chance to develop complication, blocking, and no relation to the fluid intake. Number 2, reassess the client in 2 hours. It do not need. So why you spoil 2 hours? Why you waste 2 hours? Documentation the findings. Yes, whatever we do, we will document. We will keep the documentation, but what are the action? Our action, notify to the healthcare provider. Why you take the risks and in your shoulder? Notify healthcare provider for further assessment. And after notification, you should keep the document. So documentation you must do, but it is not the priority or most appropriate. Most appropriate, go for the further assessment by healthcare provider. Then go for documentation, right? So what are the rationale? Normally, a few small clot may be noted in lochia in the first 1 or 2 days after the birth from pooling of blood in vagina. Clot larger than 1 centimeter are considered abnormal. The cause of this clot, such as uterine atony, or if the clot look like bigger, need to determine or what are the underlying cause and need to treatment to prevent further blood clot. Otherwise, this blood clot, when go through the microcirculation, they will fall in stuck in brain or inside the lungs. They can lead to develop deep vein thrombosis. They lead to develop pulmonary embolism. And what are the life-saving or life-threatening medical condition? So postpartum teaching is very important, right? So this lead to the deep vein thrombosis or pulmonary embolism. So it is very important to prevent any kind of coagulopathies here. What next? Question here, the nurse has providing discharge instruction to a client who delivered a healthy newborn by C-section or cesarean delivery. Which statement made by the client indicate need further instruction? Means what is doing wrong? Something is wrong, you need to correct them. There are 4 options here. Something you are wrong, I need to correct, my friend. After delivery, always we do the assessment. We assessment patient bladder, uterus, breast, bowel, lochia, and C-section, incision site, or episiotomy, right? Like here they said, patient is doing the cesarean section. It is surgical operation. They need a special education, teaching during the discharge. Like They said there are 4 options. As an example, even not only cesarean section, if mother given normal delivery with episiotomy, we check the redness, edema develop, ecchymosis, or any extra drainage, right? Important. So in case of cesarean section, mother need rest to healing up. So number 1, I will begin abdominal exercise immediately. I believe you do not need to read rest of things. Absolutely wrong. A mother have done cesarean delivery, a big incision done in the lower abdomen, and she going to start abdominal exercise immediately. Full of wrong. Definitely they need to educate. Number 2, I will notify the healthcare provider if I develop a fever. Fever indicate the infection. It is good. Definitely they do this. Nothing wrong. I will turn on my side and push up with my arms to get out the bed. It is good. The pressure push on the hand rather than to the lower muscle. I will lift nothing. Yeah, nothing. Heavily than my newborn baby for at least 2 weeks. It is a good. But number 1 is wrong. Need to further education. So what is their rationale? The C-section delivery require incision made through the abdominal wall and also into the uterus. Abdominal exercise should not be start immediately after abdominal surgery. The client should wait at least 3 to 4 weeks post-operatively to allow for the healing of the incision. So definitely this is the not a good choice. So what next? The question, the nurse is monitoring a client in immediate postpartum period for sign of hemorrhage, right? Which sign is noted would be early sign of excessive blood loss. So when excessive blood loss, patient develop hypovolemia, and if you do not correct it, it leads to shock. So what are the sign of shock here? This is the answer, right? So after the delivery or postpartum period, the hemorrhage is important to management. And there's some risk factor. Mother could develop the postpartum hemorrhage or postpartum blood loss. One of the important causes are uterine atony, or precipitous delivery, retained placental fragment inside the uterus, or any kind of hematoma formation during the delivery. Or sometimes inversion of uterus. So all of the factor, what I mentioned here, chance to develop blood loss or hemorrhage. So every student must know what are the sign and symptom of excessive blood loss or hemorrhage. So here said 4 option, which is the answer? Like temperature is 104, temperature is 104. So after postpartum period, temperature is little bit high, is nothing wrong. Increase the pulse rate 82 to 102. So 102 means patient develop tachycardia, and tachycardia, one of the sign of hypovolemic shock, or one of the sign of excessive blood loss, right? Definitely number 2 is important. Blood pressure change 120 over 80 to 124 over 80. So it nothing big change. But if patient have hemorrhage, we get hypotension, but it is not hypotension yet. Increase the respiratory rate from 18 to 22, little bit higher, not too much, right? So only tachycardia here, this is the, you can choose. Other sign you can get cold and clammy skin, it is not here, or constant oozing of blood from the vagina, also sign of excessive blood loss, or decrease the heart rate, important. So now go for their rationale here. During the 4th stage of labor, the maternal blood pressure, pulse, and respiratory rate, means vital sign, we have to check every 15 minutes. And during the first hour, an increase the pulse is an early sign of excessive blood loss, because the heart pump faster to compensate or reduce the blood volume. A slightly increase in temperature is normal after postpartum period. The blood pressure decreased as the blood volume diminished, but decrease the blood pressure would not be the early sign of hemorrhage, and in that case it is still normal, so it is not important here. So what are the early sign and symptom of excess blood loss, or signs symptom of postpartum hemorrhage? If the perineal pad saturated less than 15 minutes, it indicate the excess fluid loss or blood loss or hemorrhage. Even if the blood clot is bigger than a quarter, it indicates excess blood loss or hemorrhage. Tachycardia, hypotension. Tachycardia means increase the heart rate. Hypotension, decrease the blood pressure. Cold, clammy skin, indicate shock, indicate excess blood loss. Or constant oozing of blood from vagina, right? This is the sign of postpartum hemorrhage or blood loss. So what are the nursing care? Our first priority, firmly massage in the uterine fundus, admit oxygen to the mother, or IV fluid and blood as prescribed. Elevated the patient leg to increase the venous return. And also it is good to administer oxytocin or other medication like misoprostol. They are uterine stimulant, and oxytocin causes the contraction and decrease the hemorrhage.